I'm Neuro and I'm Professor of Primary and Pre-Hospital Healthcare at the University of Lincoln. I'm Director of the Community and Health Research Unit and I co-direct the Lincoln Clinical Trials Unit with Professor Graham Law.
Hi, my name's Graham Law. I'm Professor of Medical Statistics. I'm the co-director of the Lincoln Clinical Trials Unit with Professor Neero Siriwardana.
Hi, I'm Elise Rowan. I have been working in CaHRU since 2019 and more recently I've been working with Neero Siriwardana and Graham Law to develop the Clinical Trials Unit. My role in the Clinical Trials Unit is as a clinical database manager, and I've been busy learning to develop online databases.
The Lincoln Clinical Trials Unit is a centre at the University of Lincoln which is looking at undertaking trials in healthcare, and trials are a way of trying to work out whether treatments are effective or not, how well they work and how they work. And so that's really very important for developing new treatments, for evaluating them and understanding how they work.
The new medical school at the University of Lincoln means that we have a greater number of people who are interested in doing medical research, and a trials unit helps to support an important component of medical research, which is a clinical trial, usually a randomised clinical trial.
Yeah, Lincoln Clinical Trials Unit is a group of experts within the university. So, for example, we've got people who are used to designing studies and writing grants. We've also got people who are qualified statisticians who are experienced in data analysis. I myself am a data manager, so I can assist with gathering data centrally from different clinical research sites. We also have support for health economics and experts in qualitative research and literature surveys.
Well, the Lincoln Clinical Trials Unit is working with our local healthcare partners in primary care, in the hospital and in ambulance services to develop and evaluate new treatments, to try and see how they work, how well they work. And this is really important because this is how we understand whether new treatments are going to work, how effective they're going to be, how cost effective they are. And so that's really critically important for improving healthcare and outcomes.
But the aims of the Trials Unit are to bring together people within the university and the wider community to do clinical research. And the idea is that we're here to help develop the medical school and the School of Health and Social Care here at Lincoln University, but also to engage with our local hospitals, local GPs and other local health care providers who have huge amounts of expertise and probably would like to be more involved in research. And the idea of the Trials Unit is to gather people together to deliver good quality research studies.
We hope that the Lincoln Clinical Trials Unit will become a localised base for good quality healthcare research in the future.
We're right at the beginning of the journey of developing the Clinical Trials Unit at Lincoln, and even over a relatively short period of time, we've developed a fantastic group of staff. We've developed a number of new studies and trials that are taking place at the Clinical Trials Unit. We've had a huge amount of support from the university. We're based at the Lincoln Medical School, and what we see over the next few months and years is the work of the Trials Unit expanding to undertake more studies, more complex studies, working with our healthcare partners locally, but also regionally, nationally, and in the future internationally to develop really good evidence for treatments and future treatments.